Hello, everyone. This is Chadi Alraies from CVI 2022. I'm really privileged today to have a friend and colleague to be with us, Dr. Srinivas Iyengar. He is an interventional and structural cardiologist at Boulder, Colorado. Srinivas, always nice to see you.
Yeah, great to see you, Chadi. It's great to be here in Denver, not too far from home. This is great. This conference is doing really well.
Absolutely. So we are an innovation conference, and you presented today about the new system for Evolute FX, which is supraannular system. New innovation is going to give more therapies for patients, but teach us about it more.
Right. So, Chad, the data for TAVR, as we know, for the last 10 years, has been rapidly changing. We went from a situation where initially it was all the balloon expandable intraannular platform for TAVR. Since that first iteration, we've seen multiple other valves come about. And one valve, or one particular valve, is basically the Evolute platform by Medtronic, has really shown some durable data. And as the years have gone on, the valve itself has improved. But the best part of the situation is that we're seeing now, finally, 10 years into TAVR, that we really need to know about durability of valves.
Yes.
And that's the key point here, because the patients are becoming younger and younger that are asking to get these valves.
Yes.
And the data supports it. So low-risk patients can get TAVR now compared to open AVRs. So recent data, there is actually now data out 5 years showing that the supraannular platform, the Evolute, is actually superior to structural valve deterioration in comparison to surgical valves.
TAVR, yeah.
So it's amazing that we can see less deterioration with a TAVR valve when compared to a surgical valve, which is something we've never had before.
Correct.
So now we are finally showing that, okay, it's apples to apples. It's not the apples to oranges, controversy that we have in stents and bypasses that we've had for years.
Exactly.
So we're finally seeing that, hey, this bioprosthetic valve that's placed obviously minimally invasive is actually showing less deterioration than our surgical counterpart.
Yeah.
Also, in the TAVR world, we are seeing longer durability with the supraannular platform rather than the original balloon expandable intraannular platform. And a lot of that is because it just makes common sense. When you're putting a valve into someone's annulus, and if you're placing it above their current annulus, you could theoretically place a larger valve. So the phrase, the term EOA, estimated orifice area, you want to put in the largest possible valve in any given patient.
Yeah.
It's simple. Larger the valve, the more likely it's going to stay open and last.
Nice.
So what the supraannular platform gives everyone is the ability to put a larger valve in. And
Right.
so Medtronic kind of blazed a trail with their Evolute platform. The Pro Plus is what we have currently. But in the next 3 months, we're going to be seeing the Evolute FX, which is a newer platform which is going to offer an easier way of delivering the valve through the groin, more flexibility to get into the annulus, and markers on the valve itself so you know where the depth, exactly, so you know where the depth is, and so make sure that your coronaries are not isolated on a barb or a strut. So that is going to make life a lot easier for interventionalists and surgeons deploying these valves. But again, as an interventionalist as you are, 2 in the morning, when you get called for a STEMI, you want to be able to get in the coronary. And if it's through one of these valves, you want to make sure that you can get in with your guide without a problem.
Especially you are putting in younger patients.
Exactly. They're going
to predispose for heart disease.
And they're going to have a chance, of course, of having heart disease later in life. If they're younger, they're getting it. But I think at this point in time, we're seeing an inflection point of TAVR really showing its muscle against surgical valves, and this particular platform is showing its muster against the balloon expandable platform. So I suspect it's just going to get better. Now, we haven't yet identified what the next big wave will be, is when the TAVR valves start failing themselves because they're bioprosthetic, and they eventually will. What's the next step? And that's when we're hoping that we're going to see a valve that we can place in these valves that will not obstruct coronaries or cause any issues.
Absolutely. So that was my next question, which is you already partially answered, is for bicuspid valve patients who are younger, going to put a durable valve that lasts longer. We know we don't have a 10-year durability data, but at least comparing to the TAVR population, they did better.
And we're very close to 10-year data. There was a trial called the Notion trial that came out about 1.5 years ago with 8-year data of supraannular platform, the Evolute platform, showing durability out to 8 years. We're almost at the 10-year mark. So I have a feeling that we are going to see some very good data with this particular platform.
Right.
The issue, of course, comes down to it's all about the biggest valve. So if you're not putting in the larger valve for these patients,
Not doing
you're
anything
obviously not going to see the durability probably as long.
How about the axis? Same size, same size, smaller sheath, same size sheath?
Same size sheath as it was before, and if anything, the nose cone of the FX platform is now longer and tapered, so it's easier to enter in the groin area, whereas before the nose cone was a little bit more narrow and it was a little harder to introduce. So this has changed from access issues, making it much easier. So, and again, the big difference too is we don't have to worry now about tortuosity in the aorta or getting around the annulus, because the new device has one spine and it makes it easier to torque it across the aorta without any issues.
Nice. Well, new technology, new innovation at CVI. Thanks so much for teaching us about this new upcoming technology that's hopefully going to be soon available on the market. Thank you, Srinivas, for your time. Please watch these videos and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado.